Hi ladies, how are you all doing? Welcome to our taboo topic channel where we talk about female pelvic floor issues, problems and disorders. So today we are going to talk about our pelvic organ prolapse. Research has shown that around 50% of the women actually suffer from pelvic organ prolapses. So what is a pelvic floor organ prolapse? Like I said, we always try to explain things as simple as possible so we all are on the same page on this channel. So pelvic floor organ prolapse is basically the dropping of our pelvic floor organs. In the medical terms, we call them cystocele, rectocele, etc. But I said we try to make things simple, so I'll show you all again what we mean when we say prolapse with our pelvic floor model. So hi ladies. Okay, there we go again. That's our bladder, our uterus, fallopian tubes, and our rectum over there right behind. And then supporting them are our pelvic floor muscles. And then when we say prolapse, we mean the dropping of our pelvic organs. And these could be our bladder, could be our womb, could be the vagina, could be our rectum. And so how do you know that you have a prolapse? So when our pelvic floor muscles are weak, then they cannot support our organs anymore. Like when our abdominal pressure increases, it can actually push down our organs. How we test it normally is we ask patients to cough. When they cough, you would see, if they have a prolapse, you would see that it depends on what organ is coming out. If it is the womb or it's the bladder, you would see that a particular organ is coming out. We can tell exactly which one it is, but I will just show you all here. This is something I invented to show you all. So let's say this is the vagina space, and then when we ask a patient to cough, or when you cough, you see that, let's say this is our bladder or our womb, and when you cough you see it bulging out, and when you contract back it goes back in, and then when you cough it comes back out. So I'm gonna do it sideways so you see. Again, there it is, you don't see anything, and then when we cough you see it bulging out and back in again and bulging out. So it can actually happen. Some women tell me, yeah, I feel it later in the day after walking for hours or after work, and if I stand for a long period, then they feel it. So basically, what are the symptoms? You just feel this heaviness, this discomfort, pressure in the vagina, something that you just feel that something is not right. It can also be painful, or be painful during sex especially. This could actually be a sign that you have a prolapse or a dropping of a particular organ from your pelvic area. These are the signs basically. Or when there are women that actually see it, you can lie down on your back, have a mirror right in front of you, and cough, and then have a look at it, and you would see if something is coming out or not. Then again, like I said, if you find one of these symptoms or two of these symptoms or any of the symptoms and you're not sure, please visit your doctor and get your proper diagnosis and a treatment for you. So what are the causes of prolapse? I know it's easy to talk about something, but people want to know what is causing this. How can I deal with this? Or how can I get it treated? That's what we're going to tell you all. So the causes of prolapses could be pregnancy, childbirth, aging, obesity, pelvic surgeries, chronic coughing like COPD, constipation, especially chronic constipation. There are people that are constantly constipated, and then when they are passing phases or when they are on the toilet, they constantly pushing, and this puts a lot of pressure on the pelvic floor muscles and stretching. Postmenopause can also be a cause of it because of the reduction of the estrogen levels that we have as women in our system. I am going to talk about in detail few of the symptoms that I just mentioned. Aging. All of us are gonna age. At least we hope that we would age. And when we age, we want to age gracefully, healthy and all that. And so I would usually say, you know, like we said, it's never too late to train any muscle, especially our pelvic floor muscles. We can train them at any stage of our lives. Childbirth and pregnancy. We say every single pregnancy actually decreases or affects our pelvic floor muscle power. And so you could imagine after the first child, like we said in our previous video, that the pelvic floor supports our baby's weight and all that, and we have this pressure on our pelvic floor organs months long, and then the pelvic floor muscles have to actually work extra hard, plus do child delivery, the extra stretching of the muscle, and then the next child coming, the same process coming. So every pregnancy that we have, it actually affects our pelvic floor muscles way more than we actually know. I talked about pelvic surgeries, especially when the womb is been taken out. So you could all imagine, I'm gonna show you now, that is it. So let's say we have a tumor in our uterus or in our womb, and then the doctors suggest they're going to take it out. Or we have endometriosis, and the doctors decide they're going to take the womb out. But when the womb gets out or gets off, we have our vagina right here that's attached to the womb. It's also been supported here. And when this part is taken off, this part loosens and it kind of like drops. And your doctor will tell you exactly when you're doing that kind of an operation, they actually pull the vagina and then attach it to the backbone somewhere. But they will tell you exactly the procedure. They know it better, and they tell you exactly what you're gonna do, and then the effects of the after operation. So this could actually also could be a cause of a pelvic floor or a pelvic organ prolapse or dropping of our pelvic organ, the vagina. Now, after discussing the causes and the signs or symptoms, we're going to talk about the treatment possibilities. Treatment possibilities with dropping of our pelvic floor organs could be surgical. If you see your doctor, they'll tell you exactly what they're going to do, how they're going to do it. They explain the whole procedure to you. And you have PESARs. These are silicone devices. They come in different forms, and then what you do is insert it in the vagina and then push back and then put back the particular organ that is dropping in its place. You also have other treatment possibilities. This channel, like I always say, we're going to talk about our physical therapy exercises, because the thing is, it is important. Most doctors would send their patients to do physical therapy first before they even do the surgery. If it helps, then they will say, okay, no surgery. If it doesn't help, then they would do the surgery, and then after surgery they still do the physical therapy treatment. So there is no escaping off the physical therapy, so you might as well start with it. And like I did mention this before, but we have different degrees or stages or seriousness of the pelvic floor organ dropping. It can be, some people classify it from mild to severe, some people have it on grade 1, 2, 3, so it depends. But when you see your doctor, they'll be able to tell you exactly which grade you are at, and then what is best for you. We say in physical therapy, as long as your dropping of the organ or your prolapse is not causing you problems, it's not preventing you from having a quality life, then you should let it be. Because then again, the reason why we say that is we just mentioned that every pelvic floor surgery could actually be a possible cause of something else. That's the reason. So if you have questions, please ask your questions. If you want to share your story, please share your story. I'll be glad to hear that. And until then, I'll see you all on the mat. Hi ladies, so I just want to emphasize how important the foundational aspects of the pelvic floor training is, Those are the breathing exercises, the core contractions, like using the right muscles that you need, and then making sure that we are squeezing and contracting our right pelvic floor muscles. And how do we do that? When we inhale through the nose and our tummy goes up, and when we exhale, it goes right back in towards the spine. That is how we do it correctly. So inhale and exhale. When you do this exercise correctly, then you're ready to move to the next stage. The next stage would be trying to locate our pelvic bone right here, and then just put your fingers on it, and then inhale through the nose, and then when you exhale through the mouth, you squeeze the pelvic floor muscles. That is imagining that you are stopping urine from passing, or you're stopping gas from passing through the anus, and then you would feel a little light contraction on the muscle. If you feel this light and gentle squeeze, it means that you are contracting and using the right muscles. These are the three fundamental aspects that you need to have correctly in order to make sure that your pelvic floor exercises are done correctly. Dive down straight into our exercises. So I'm going to show you super important position. We call it gravity position. This helps the pelvic floor organs to go back into their positions, and then every other position we're going to do would be derived from that position. At home, of course, we try to make things as simple as possible, things that you can actually find at home. And these are two pillows that actually I got from my sofa, and then your pelvic region should be on it. And then try to do this on the sofa, or if you have a chair at home, I'm sure you do, use your chair to support your legs on it. So my feet are quite supported, my pelvic area is supported. After a long day of walking or standing, you feel this discomfort in your vagina, you feel like something is just not right. You can go on this position, and then it will help you to pull back all the organs. And you can also combine it with your breathing exercises, with inhaling through the nose and exhaling through the mouth. Just relaxing and letting gravity take care of its job, Good. Then the second exercise that we're going to do in this position after resting for a while is the breathing exercise again. But this time we have our pelvic region supported. We inhale through the nose, exhale through the mouth, tummy goes in, we squeeze the pelvic floor muscles again, lift them up, and then go into the breathing position. When we are in this breathing position and we're not fit enough, it might be very difficult, and you feel your legs are shaking, just go back down again and then repeat the exercise again. Inhale through the nose and exhale through the mouth. Squeeze your pelvic floor muscles by imagining that you're stopping your urine or gas from passing. Lift it up and then go in the breathing position. 10 seconds and then go back down. Yeah. So in this same position now, we're gonna have our last exercise for the day today. And we are going to inhale again. Exhale, squeeze our pelvic floor muscles by imagining that we're stopping urine or gas, and then bend the leg. 10 seconds and then go back down again. Again, inhale, exhale. Squeeze the pelvic floor muscles and lift, and then back down again. So ladies, that would be all for today. I hope these exercises would actually help you try to manage or control your prolapse. As long as you do the exercises, you're good to go. If you have any questions or you need personal coaching, just contact me and I'll be your lady. Bye.